There's no question we're at a very definite inflection point in history where what has traditionally been a hospital-only procedure, it's an outpatient procedure now. And we just were fortunate enough and I think brave enough to embrace that idea early and to create something that lets us be here at that inflection point. This is an operating environment built by a surgeon. It's hard to overstate how important that is. It allows us to perform high acuity cases in a way that is more efficient and more patient-friendly and more surgeon-friendly, all in this wonderful environment that we got to design. Something that's this large, that requires a lot of patient confidence. The second they step in the building, it has to tell them that this is the place they should be and that things are going to be great. On top of looking the part, it had to be the part. We're going to do a lot of procedures here, so there's going to be a lot of people waiting. So we created that entry, that lobby, to allow there to be multiple waiting spots. It allows people to sit over and charge their phone, or they can be over by the television, or they can be in a spot reading, or they can be by the refreshment bar. So that worked out really nicely. Something you'll notice when you come into our center is that everything is open. The walking areas and the hallways are all much wider than in a standard surgery center. We did that not just for functionality, but for the eye. And so again, when people come in, they feel automatically relaxed and they feel, oh, this is a place that can handle what I'm doing. In the middle, there's kind of a central area that both pre-op and post-op share that allows nursing to go back and forth from pre to post-op really easily. So while they communicate, they're still separate, but it's kind of formed like an H. We built a hallway in the back of the surgery center that connects the pre and post-op areas. This is an awesome hallway because we actually did it just because we needed a place for the therapist to work, but we needed therapy to be here to help people ambulate and make sure they could safely ambulate. And we needed a place for people to practice going up and down stairs. We have 2 rooms literally in between pre and post-op that are private rooms that have a glass screen privacy door. Total joints start off in those rooms in the morning, and then when they come back to recover, they recover in that same private space. The OR is straightforward, they're big, and the ORs are exactly as big as our hospital OR. We literally went and measured our OR that we like to work in, and that's how we shaped it. In a standard surgery center this small, it's almost impossible to do this level of cases, so we needed them to be big, and they're state-of-the-art. So when we built this place, we involved anesthesia and the other surgeons, and we didn't pull back. This was an investment for long term, and we're doing high-quality surgery, so we bought high-quality equipment. One of the factors that increases infection risk in an operating room environment is air movement. Traditional doors open and close by swinging, and every time that door swings, it creates a vortex of air that kicks bacteria up and increases that risk of infection. And these doors slide back and forth, so there isn't any of that vortex of air, it just slides back and forth. And that's a small detail, but it's something we're pretty happy about. The area where we clean equipment, there's a dirty room and there's a clean room. When you talk about the cases that we're bringing here, it requires a high volume of tools. And in a standard surgery center, they never built themselves with the idea of a procedure that required large amounts of tools because it wouldn't have been smart to do that. You bring a total joint replacement or a spine surgery into a surgery center, and there's a lot of stuff you have to clean. So one of the things that we said we had to have when we built this place was a hospital-sized cleaning space. So it's one of my favorite rooms, and when you bring people in here from our industry, it's their favorite room too, because they can't believe that we would do that. When we leased this space, we ended up with about 6,000 extra square feet, which we decided not to develop. We're not sure what we're going to do with it because we're going to let time dictate what happens. So we have a big empty space there. We have this room to expand where we're going to be able to be agile and adapt. Put 2 more ORs in, put an extended recovery area in if Medicare can come here. There's nothing we won't be able to adapt to because we have that space.